Welcome back, ladies and gentlemen, to On the Air. With me is Mr. Kevin Brown. Good afternoon.
Good afternoon.
Now, Mr. Brown, at the beginning of the AIDS crisis, we used to say AIDS victims, and AIDS being what it is, we used to say AIDS victims. Mm-hmm. Now we say persons with AIDS.
With AIDS, yes.
Which is better?
People with AIDS is probably better, PWA. We don't like to see ourselves as being victimized. And I think this is was a catchphrase that the media came up with. Yes. They love catchphrases, and it's stuck, unfortunately.
So you prefer a person with AIDS? You are, sir, a person with AIDS?
Yes, I am.
How do you know that?
I was diagnosed last June 5th with pneumocystis pneumonia. Came as a great surprise. I knew I hadn't been feeling quite well for a little bit, and figured there was something wrong with my lungs. Had gone into the hospital, and where I had the first indications that all was not well. And they did a bronchoscopy where they go into the lung, examine a piece of it to test for the pneumocystis organism, and the tests were positive. So then you have to sort of rebuild your life. It's quite a shock.
The shock consists in the fact that there's no way out, is there?
It does appear to be a terminal disease. From all we've told, it's terminal. My feeling is that there's a fair amount of experimentation going on with new drugs, some antivirals, some immune boosters. My biggest concern was getting hold of some of these. Ever since I was first diagnosed in June, I've been trying to get access to some of these experimentals.
Which are in the States and which the Canadian government will not allow in the country?
No, the government won't allow them in.
How do you get them? You have to smuggle them, or can you get permission?
I have brought them in from Tijuana. One of the drugs specifically is called ribavirin. It's an antiviral. And the other one is called isoprenosine.
And how do you know that they are any good?
There has been some experimentation in the United States with these drugs. In the laboratories, they seem to slow the growth of the virus, and basically they will not cure the disease, but hopefully you will sort of plateau so that you won't fall any further in your immune system. My helper cells have fallen to 30.
Your what?
Helper cells. There's helper-suppressor cell ratio.
Yes.
The normal ratio should be close to 1,000.
So you have fallen to 30.
30.
Are you keeping falling in spite of these new drugs you are using?
I just started the new drug therapy about a month ago.
And are you doing that with a doctor?
My doctors are not permitted to give them to me. It would be a breach of their protocol. And they are aware that I am taking them and will confer with me and do blood work with me. But they're bound by laws that they have to follow.
So, by the way, ladies and gentlemen, our number is 872-6631 if you want to join our conversation, 872-6631. I don't want to sound skeptical, you know, and
no,
but I
know.
hear about things, you know, that come from down there or everywhere, and we used to have cures to cure cancer by breathing God knows what, you know. And I want to make sure that you know what you are doing, and how do you know that what you are doing is the right thing to do?
I'm quite cognizant of what I'm doing. I have read up on literature. I have studied and networked with people in the States and with other friends also in Vancouver who are taking similar drugs. My feeling is that I have to have a chance to explore every opportunity to save my life. And I'm finding the Canadian government has denied me that opportunity. I felt very much led down the garden path. My doctors were misled by the government on several occasions.
About these drugs. Are they allowed in the United States by doctors?
It's now permissible to have ribavirin in the United States. It was a controlled substance, and now it's permissible.
What does the Canadian government tell you that why it won't allow them here?
Nothing. Basically, they'll only speak to doctors. I have been told in a meeting in October last October with Dr. Liston from the Laboratory Center of Disease Control that the drugs would be released on compassionate grounds.
Yes.
My doctor immediately went out and filed on compassionate grounds to have the drugs released for myself and another fellow, and was refused. I have since brought this matter up
Yes.
2 Fridays ago with Jake Epp,
Yes.
who was passing through town on his way to Japan. I cornered the minister at a meeting, and he graciously gave me about 10 minutes of his time to talk about this issue. He was quite amazed that they were not being released.
Because on the grounds that they had said they could be released.
He was under the assumption they were being released,
Yes.
that no one had applied. I said, no, I've been refused not once but twice.
Have you heard since?
Not yet. He said he would get back to me when he came back from Japan, and we had a chance to
When was that?
look into it.
When did you go to Japan?
That was about a week and a half ago.
Oh, well, then we'll give him another week and see what happens. All right, we're going to take some calls, all right? And then we'll talk some more. Hello, line 1.
Yes, I just had a quick comment on the Beaufort Sea incident, if I could. I was just wondering, were any fish hurt in the accident?
I don't know, but I will find out. Thank you very much. We're talking about AIDS, ladies and gentlemen. No crucial testing now. We've done that. AIDS is now our concern. We shall go to line 2. Hello.
Yes, I was wondering if you could give me, the gentleman could give me an idea what symptoms he had when he found out he had AIDS.
Okay, symptoms. I came down with pneumocystis pneumonia. The symptoms were shortness of breath. I started having fevers. There were night sweats during the evening. I had a bit of pain in my chest when I would breathe in very deeply. Those are the symptoms. A bit of headache. It just feels very much like you're having pneumonia. Unfortunately, it's not. It's caused by an organism, the pneumocystis organism, which most normal people with a healthy immune system would never get.
And then you went to your doctor right away.
I first of all went to emergency. It was on a weekend. I always seem to get ill on weekends.
Yes.
And then I went to see my doctor and was admitted to St. Paul's for a bronchoscopy.
And the rest followed.
And then the rest followed.
Line 3, hello. Line 3?
Yes, hello. I just had a quick question regarding the drugs that the gentleman was talking about, and that the Canadian government wouldn't be allowed into the country. I was wondering, is Canada doing any research at all regarding AIDS, or is it strictly all the research being done in the United States?
Very good question. That I know of, there is absolutely no research going on in Canada. There is no funding, and there's no research. In order to do adequate research, it is necessary to have a viral testing laboratory built.
And we don't have one?
And we don't have any. There's one in Montreal, and there's one in Ottawa, and they're too busy doing other things. We need one built in Vancouver. We need one built in Toronto.
And this in order to test?
You see, if you're using an antiviral,
yes,
they'll take samples of your blood and then try to culture the virus from your blood. If they're having difficulty culturing the virus, then that would say that the antiviral is working effectively.
Thank you. We shall go to line 4. Hello?
Yes, I get a little bit worried when I hear about this drug therapy, and I think the government is cautious in allowing these drugs to be used. I'm reminded of the incident that occurred in the 1950s in response to the adenovirus and polio epidemic, where they developed vaccines in about 1956, used them for 4 years, and tens of millions of people were inoculated, and they discovered in 1960 that these vaccines were infected by a tumor-causing virus. Now, we have AIDS, which is a new disease. We don't know much about it. And the drugs that they're using will also be new in response to a new disease.
So we must be cautious.
We must be very cautious, I think, because it's possible that what happened in the adenovirus was that the vaccine recombined with the genetic material of the organism and produced a third virus.
Okay.
And this actually has been implicated in the origin of AIDS itself.
Okay.
The AIDS virus is only one in a family of 3 viruses. The other 2 cause leukemia, and leukemia is epidemic.
All right, just a minute, okay?
My feeling on that issue is the fact that we know that what I have is killing me. What could they possibly give me that could be any worse? I'm willing to take the risk. I'm not affecting anybody else's life, and I'm not suggesting that people madly run out and start taking these drugs. But I have the disease, and I have a right to try anything
You're dying.
If I have AIDS, then the success rate is extremely limited in anybody that survives.
So you're prepared to take the risk?
Yes, I think that the risk that I have the right to take. And no one has the right to deny me that option, which is the way I've been feeling lately.
That you've been denied that?
That I was denied the option that I had to go outside the country to.
Yeah, and alternate therapies. Line 1, please. Line 3. Yes, hello?
Hello?
Yes?
Yes.
I can't hear you, sir.
Hello?
Yes?
Yes. I'm wondering, if you went to your doctor, what would you ask him to look? If you went to your doctor, what would you ask him to look for the symptoms?
Okay.
Oh gosh, it's hard to say. There can be many symptoms. I have yeast infections that are in my mouth. You can have some skin problems, a bit of flaking of skin. There can, if you have the Kaposi, there could be lesions, that's the skin cancer. It's really difficult to say. There are many different symptoms. I suppose effectively, to find out if you have the virus, you could take the testing for the virus, so there is problems with that. Many people are devastated when they find out that they've proved positive to it. If you are leading a lifestyle which is questionable, my feeling would be to find out from your doctor.
Yes. Do you blame your lifestyle? You've used the word questionable, and we read in books like Living with AIDS and other things, and all the pamphlets that I got in preparation for this, that it describes that AIDS is a product, in a sense, of a lifestyle.
No, I don't believe so. I believe is that like saying that cancer is a product of a lifestyle. It's a disease. They believe it came from Africa, and predominantly it is a heterosexual disease in Africa. And it was probably transmitted several years ago into North America in the gay population and has simply spread from there.
So from you, people who say that if you had you just said, if you have a questionable lifestyle, watch it.
Questionable in the sense that you're not engaging in safe sex practices.
I see.
My feeling would be that most sane human beings nowadays should only engage in safe sex, which would be the use of condoms, now that the report from San Francisco has shown that they are 100% effective in stopping the virus, and not exchanging bloods or those types of fluids.
Being very careful.
Being very careful.
How old are you?
37.
You're a young man.
Relatively, thank you for saying that.
Do you regret anything in your life that has brought you to this threshold of...
No, I regret nothing. I've never regretted being gay. I am not ashamed of this disease or embarrassed by it, just like no one could be embarrassed by cancer. I do not blame being gay for having this disease. And...
yes. Where do you go from here? Do you get up in the morning and say, cross one more date off this calendar?
Yes, each day is new. Sometimes you can't tell how you're going to feel every day. For the past couple of days, I've had a very high-grade fever in the evenings and some night sweats. So I'm a little worried the pneumocystis may be coming back again. But I'm a fighter. I try to survive, and I'll continue to struggle. Encourage other people out there that they should struggle as well, that life is worth living.
Yes.
And even though we may have what they call a terminal illness, it's an enjoyable life, and I'll make the best of it.
Thank you. Thank you very much, Reverend Brown.